Welcome to this short abstract presentation on our recent publication on methylation risk scores for childhood aeroallergen sensitization with results from the LISA birth cohort. We conducted our study in the prospective German LISA study on allergic diseases, where we had paired DNA methylation measured at both 6 and 10 years of age using the Illumina EPIC chip. Methylation risk scores, or MRS, are weighted sum scores based on previously identified CpGs, which we calculated for 6 EWAs on different allergic phenotypes. MRS were then investigated regarding their performance for our main outcome aeroallergen sensitization. Figure 1a presents the risk ratios of average MRS performance per EWAs in 4 time models. The first 6 MRS are based on EWAs on allergic phenotypes, while the last one is an MRS on schizophrenia as negative control, and models are shown both cross-sectionally and prospectively. We do observe a 70% increase in sensitization risk in the first cross-sectional model and further significant associations in all but the last prospective pane. We further established a dose-response relationship between our MRS and RAST classes of sensitization, which broadly correspond to more allergic symptoms. Here we observe a nice upward trend cross-sectionally in all allergy-related MRS with higher RAST classes, while if we look at the same plot for prospective analyses, MRS for 6 and sensitization for 10 years, this trend becomes weaker though still significant. Concluding, we found that our MRS are rather cross-sectional biomarkers than prospective predictors of sensitization. Further, all MRS for allergic phenotypes perform similarly good for our outcome. If you are interested in further findings or more detailed discussion, please have a look at our paper, which is openly available at Allergy. Thank you very much for your interest and our further expressed gratitude to our study participants, hosting institutions, and funding bodies.